Okay, this is the analysis I want you guys to do. This is just to show that you know the analysis process for the Diagnostic protocol. And I'm going to run through it, kind of just show you what I'm looking for, okay? When I get to the motion palp part, the thing you got to remember is you need to tell me what you're contacting, how you're going to move it, what you should feel if it's normal, and what it means if it's not normal. Okay? That's basically, remember those 4 things, and you'll be fine on whatever motion palp you're doing, all right? So we're going to turn him around this way so we can see his back. Also, remember to kind of focus, if you're shooting a video, focus on the things that are going to be important. Like in a minute, you're going to want to focus on this so that we can see the angles and things like that, right? Okay, so I'm going to start now. I'm going to take a look at my patient. I'm looking for anything that might affect my nervous scope, like moles, scars, ticks, leeches, things like that. I'm also going to look for any visible edema over the spine. That's observation. Instrumentation. I want to turn the instrument on. Use the square button, turn it on, set the sensitivity to medium. I want these probes to be as wide as possible, but still get a good seal in his neck. That's as wide as they can go right there where the muscles drop off. So about there, tighten it down. I'm going to place it about T2, and I'm going to glide upward. I'm looking for a quick over and back swing of the needle. Okay? Once I find that over and back swing of the needle in a short distance, I'm going to repeat it 3 times. If this break is still there, when I'm going up the spine, I will mark it on the trailing edge of the hot side. That's the bottom edge of this, just as the needle breaks back. Okay? We'll open it up, go back down, place it above that T2 spot where we started, and I'm going to go down the spine. I need to stay centered on the spine. I need to have the probes perpendicular to the spine. This is true in the cervicals too. I need to have just enough pressure on the probes to put a good seal around the tip so you get a little dimpling. I'm going to glide down. I'm looking for that quick over and back break. When I see it, I'll repeat it 3 times, and this time I'll mark the trailing edge. In this case, it's at the top instead of the bottom. Okay? Just so you can see that real quick, this is not, you don't have to do this part, but I want you to see the angles that I'm talking about. See how it stays perpendicular to the skin? Okay, when you shoot it from the side. Shoot that portion of it. Move your videographer to the side and shoot it like that. Okay, so that's observation and instrumentation. We would continue this right on down into the SI joints, by the way. The static palp. I'm looking for palpable edema. Cervical spine, I'll put one finger in the center and I'm going to glide up. I'm looking for that soft, boggy feel right there where the skin's kind of mushy and thick. I'll go right in there and I can feel for pain on pressure. I'm just pushing on the tips of the spinous processes. Okay? Going down the thoracic spine, I'm putting my fingers, the spine is right here, I'm putting my fingers right alongside of it. I'm gliding down like this on either side. And I can feel edema right there. It's sort of soft and squishy. Okay, and there's some edema right there, a little bit more right there. Okay, pain on pressure under the tips of the spinous processes, just like that. Okay. Now for motion palp. Depending on which card you draw, you may do any of the motion palp that's involved that we've done up to now. I'm going to start at the top. Now you'll have one section that's either going to be atlas, occiput, or spine. And that could be cervical, thoracic, or lumbar spine. You'll have one of those, and then you'll have some combination of stuff for the SI joints. So I'm going to run through each of them really quickly. All right? So I'm going to turn him this way. I'm going to start with occiput. I'm going to put my fingers on either side, or in one side. I'm going to feel between mastoid and C1. Okay, this is perfectly fine. And I'm going to tilt the head to the right. I'm looking for this to close down. If it doesn't close, that's the sign of laterality. Okay? Yeah, do the same thing on the other side. Next, I'm going to check him for P to A glide. So I'll tilt his head to the side that's involved and glide P to A. Looking for restriction. If it's restricted P to A, I now have a PS on the right, so it's a PSRS. I go A to P glide. If it won't go posterior, that means it's an anterior on the right, an ASRS. Last but not least, I want to feel that mastoid C1, and I'm going to just rotate. And I'm looking for how well does that mastoid glide forward relative to C1. And we'll do the same thing on the other side. Whichever side won't go forward is posterior. If I'm interested in the other side, that would make it anterior. Okay. For the atlas, similar type of thing. C1, C2, I'm going to tilt the head. I'm looking for C1 to close on C2. If it won't close, that's the side of laterality. At that point, we'll have to stand the patient up. I'll have him close his eyes, drop his chin, bring the head up. Just all back and forth until you feel comfortable and come to a neutral position. And we're looking for, stop, comfortable position. In his case, he's got a little bit of forward head carriage, a little bit of a chin flat, but the head's forward, so it's probably an AS. Okay, go ahead and sit. And for the last component, I'm just going to drive the car. I'm going to rotate and feel the back of his posterior arch of atlas on the right and on the left. And whichever side does not go forward, that's the posterior side. For the spinal segments, in the cervical spine, I've got one finger between. I'm looking for flexion first. I'm looking for them to open. If they don't open, that's the one on top of the two I'm feeling is the posterior one. I'll rotate. I'm looking for the spinuses to swing. He doesn't swing well when he turns to the right. That would make it a PR. Last, I'm going to check him in lateral flexion. Turn this way real quick. Let's go this way. Lateral flexion, and I'm just feeling for curve. He doesn't curve well to the right. So that means he's got an open wedge on the right. So that'd be a PRS if he had right rotation restriction. I don't remember. In the thoracic spine, we'll do exactly the same steps, but instead of one finger between, we'll put one finger on each. Down here, the same thing in the lumbars. For the SI joints, you've got two possibilities for figuring out if it's which side is involved on the SIs. The twist is one. I got one finger on the PSIS, the other one's on the sacroiliac. I'm going to extend and rotate him. And I'm feeling the top, the middle, and the bottom of the joint. I'll trade sides and do the same thing over here. Whichever side doesn't move is the side that I'm interested in. That's the stuck side. The pedos, or forward bend test, stand up. We're just going to stay right there, back up, give yourself a little room. My thumbs are on the PSISs, and I'm feeling that. As he bends forward, I'm looking. That's actually what they're supposed to do. That's a normal pelvis. Come on back up. If one of those rode up, that would be the side I was interested in. That would tell me a left, if this left side went high and stayed high. Okay? Go ahead and stay right there. Observation for the glutes. For PI or AS, we'll check glute height. Just take the slack out of the clothing. He's a little high on that side, a little low on that side. This would be the AS side. That would be the PI side. Glute width, just top of the cleft. Compare. If this is the wide side, this would be the IN side. This would be the EX side, whichever one's appropriate. Okay? Go ahead and sit. Oh, I'm sorry. Stand. If we were checking on his left side, for example, for the leg lifting test, my thumb's at the PSIS, the other thumb is at his sacral tubercle. We'll have him raise the same side leg. I would expect that ilium to roll back. Pull your knee up. There you go. Expect the ilium to roll back. If it doesn't, that's the AS. Put your leg down. When he raises the opposite side, that sacrum should drop just like that. If it doesn't drop, this is the PI side. Opposite goes with PI. So that's the leg lifting test. Go ahead and sit. Now for the knee swing, got my fingers in the joint right there. Put this foot, just put it right there. I'm going to push the knee. Now keep it just under your knee. There you go. As I push the knee in, I would expect the joint to open. If it doesn't open, it's an IN. As I swing the knee out, I would expect for this to close. If it doesn't close, it's an EX. See, that's it, guys. That's all of the possibilities that you would have for the motion pal. Just remember, what am I contacting? How am I moving it? What should it do? And what does it mean if it doesn't do it? Okay? Thanks. Good work.